You've been here for a few weeks. You've talked to some local health workers. Your impressions of where we are right now as far as our healthcare system is concerned. Your impressions as somebody who was here and somebody who's now working in the UK.
Actually po, it was really saddening to hear the stories of my fellow nurses in the Philippines. I've heard that some of them are being paid 5,000 a month. For someone who is highly skilled, looks after patients 24 hours a day, who has to go through rigorous training as well as passing the board exam, I don't think they are being given the adequate support in terms of salary. Kasi po, 5,000, umuwi po ako last week. Ako po yung namamahalan, galing ako sa UK. Pero kung meron po akong mga anak na pinagmamatrikula, na pinapupunta sa school, paano po sila mabubuhay? I just feel really sad for them that the situation that they're in. Hindi naman po siya across the board. There are pockets of areas where they're being paid like that amount, and I think it's not enough for someone to support their families and their living. I think there should be someone in the government po who can fight for them, who can fight for the rights of those highly trained, highly skilled people who looks after our community, especially during the pandemic po. I couldn't imagine kung ano pong mangyayari sa Pilipinas kung wala po tayong mga nurses to look after them. I think po sa akin, in my mind, parang they are devalued in the Philippines, and I feel really strongly about giving them equality in pay. Kasi po syempre, lahat po tayo, meron po tayong mga buhay, we need to live. And there is no loyalty for them to stay in the country if their own country is not looking after them. Sa akin po, it's just equality in pay. It's a fair pay. And then maybe perhaps we can keep them for longer in the Philippines to serve our communities. Pero I couldn't blame them po for leaving. Like for me, I served for 3 years in the Philippines before leaving. And the reason for that is because I wanted to give a better future for my kids and for my family. And pag nag-abroad po tayo, di ba, we change people's lives. We support our whole family and all our extended family. So it does have a massive impact on how we are as a community, kung paano po natin supportahan yung mga pamilya natin and how we can, madami po tayo napapapunta sa school, napapagraduate, ganyan. So I really think that the government should consider having a nurse in the governing body to be the voice of the healthcare workers and of the nurses, para naman po they're, equitably represented in the tables that make decisions about them.